Hi, I'm Dr. Melinda Henne. When I was in kindergarten, my parents started a school book for storing report cards and other important memories. There was a checkbox that said, "What would you like to be when you grow up?" I checked the girls box for nurse. My mother asked me why I wanted to be a nurse, and I told her that I really wanted to be a doctor and a ballerina. Nurse was the closest choice to doctor. This is when I learned that it's okay to check the other box and you can fill in the blank. By the time I was in high school, I knew I wanted to be the first doctor to be President of the United States. I've come to my senses since then, but I still try to think outside the box. I've always known I would be in medicine, and early on I developed a belief that emotional health is vital to physical health. For many people, the ability to have a baby is such an important part of defining who they are in the world. Witnessing my own family members' joy after conceiving with the help of fertility treatments led me to the field of reproductive endocrinology and infertility. I funded my medical school at the Medical University of South Carolina in Charleston by joining the Air Force. I completed my residency in Obstetrics and Gynecology at Keesler Air Force Medical Center in Mississippi, and this is where I met Dr. Duffy. I ultimately went to Stanford University for fellowship training in reproductive endocrinology. I had the honor and privilege to serve in the Air Force for 21 years, providing fertility services to military families and training residents and fellows. I was the Chief of Reproductive Endocrinology Services at Walter Reed National Military Medical Center, and I worked with the fertility team at the National Institutes of Health. I'm fortunate that I had the opportunity to become very skilled in robotic surgery and tubal reversal surgery, and I've written book chapters and taught courses in minimally invasive tubal reconstruction. After I retired from the Air Force, I found my way to Jacksonville and the fabulous team at the Florida Institute for Reproductive Medicine. I love my job. Nothing gives me more joy than getting to know people and their stories and helping them achieve their dream of growing a family. Technology has advanced so much since I decided that this was my calling in college in the 1980s. Every day we learn we can do so much more and achieve greater and greater success for our patients. I love all aspects of what we do here, but I especially love robotic surgery, tubal reversal surgery, social fertility preservation, and same-sex and third-party reproduction. Nothing gives me greater joy than seeing the babies that I had the privilege of helping to bring into the world. If you don't see me in the clinic, you may find me enjoying the great outdoors on the water or on hiking trails, hunting for the best vegan food in town, rescuing animals, or obsessing over my special needs dog.